Adolescents in the ACI are not a big part of our beneficiaries. This is because the system of diagnosis that we are promoting is based on early diagnosis. We face this problem because anyway, some of our kids, they didn't come very early to diagnosis, so they came that they were already 10, and so now they are 12, 13. So it happens that, in fact, some of our patients, they are on the age of adolescence. Developmental disorders during adolescence, they are showing in the same symptomatology that it's present in childhood. Of course, there are some of the symptoms that they will improve, like for example, for autism, the social communication, because it's something that it comes also with the experience of being with other people. The changes during adolescence that children with disabilities in general will face, they are the same changes that any other child will face. So there is the growing of the body, there is the different in hormones, there is the sexuality, there is all of the impulse that make an adolescent difficult, and he also make adolescence as one of the major period of crisis in the maturation of any human beings. Services that we offer for the adolescents and their parents, they touch some very important topic. They are made through psychoeducation and also through psychotherapy and counseling for the adolescents and for the parents. In some sessions, which they are for all of them as a family, and some individual sessions, some for the parents, some for the children. The topic that we touch, which they are those that we consider more important in this period of the life, they are the growth and development of their body, and then of course the issue of touching, who can touch, what can we touch, even from the adolescent with disability, respect to the others, and vice versa, and then the sexuality.
One of the things that becomes a problem for children with disabilities and their parents as they grow is that adolescence really becomes a time of differentiation. Up until adolescence, children with disabilities look the same as their peers. They're doing the same kinds of things, they're going to the same kinds of schools, and they're following the same kind of path. Unfortunately, at the point of adolescence, that really begins to change. So children with disabilities begin to see their peers go off to a specialized high school or to a university setting. They begin to talk about romantic relationships. They begin to have interest that the child with disabilities really will not have. This causes a problem for parents who kind of go through another set of grief, which is to say they go through grief when they get the diagnosis of their child. This isn't the child that they imagined that they were going to have. And then they go through a second set of grief when they realize this is the child that is going to grow into an adulthood. This child may not have a career. This child may not go to university. This child may not marry. This child may not give them grandparents or make them grandparents. And this becomes a period of sadness, of distress for parents. This is also true for a disabled child who begins to see their peers that they've maybe always played with, if they were in a good, inclusive kind of situation, also move away from them. Their peers are going down a path that they simply cannot or will not likely follow. And this causes for them also some level of anxiety and depression about who they are and what that future is going to look like. Here in Palestine, most of these children are going to be maintained in their home, which is a beautiful thing, but also a difficult thing because they don't often see progression. They don't often see a future. Children with and adolescents with disabilities also need a life work. They also need maturing relationships. They also need to be moving toward independence, even if that independence is only picking out their own clothes or making their own sandwiches at a certain point of the day. One of the things that we're working toward is finding those opportunities for children with disabilities here on the ground, which is to say, where can they go to learn something? No, they may not go to university, but they can certainly learn skills that can make them more independent. They can learn work skills that make them more productive in the community. They can learn skills that will allow them to have some sort of employment or to assist their parents in housekeeping, in taking care of the other children, in taking care of household kinds of responsibilities that really is essential, not only for them in terms of an economic point, but also for their self-esteem, for their feeling of self-worth, and for their feeling that their life has purpose.